Morning, everyone. September 21st. It's a little hard for me to imagine that we're already in the last third of September, and I guess fall is arriving as we speak, something like that. So that's exciting, I guess, and welcome everyone, and thanks for joining us today, and hope you're all doing well. So we'll go ahead and go through our normal agenda of sorts. We'll start with some introductions because we feel like that's a really important part of this group, is to know one another. And then we've got some announcements, we have some updates. We'll spend some time on brainstorming cases, and we actually got one that was sent to the listserv yesterday that I'd like to talk about a little bit more. Then we're excited to have the main part of the meeting will be UPIQ, talking about what UPIQ is, who it is, and what they do, and focusing a little bit on some of their specific upcoming projects. So we're excited about that. And then we'll wrap it up for September. So with that in mind, I'll go ahead and again, welcome you and let you know that I am Mindy Tueller. I am the Director of Operations for the Medical Home Portal, which we like to feature as a part of these meetings as a resource for all of you. And I'm also the person who oversees this group, the Utah Children's Care Coordination Network. I'm hopeful that we see some new faces on here today, as we've had some new folks request to join recently, and we love that. But I'll just mention that the Utah Children's Care Coordination Network has been around since 2015, and it came about as an offshoot, an outgrowth of a CHIPRA demonstration grant that was looking at medical home and pediatric practices, and how that improved those pediatric practices to have a care coordinator in the office. And those care coordinators who were part of that 5-year plan, I think it was 5-year project, they got so much out of meeting together and networking and supporting one another that we decided to keep it going. And so we've been doing this since 2015, and we love it. And we hope you're getting out of it what you need as well. So I'm going to go ahead and look at my participant list that Zoom shows me, and I'll just go down that list. And if you're able to unmute and speak, we love that. If you're able to unmute and put your camera on, we love that even more. But the chat feature of Zoom is also something we've come to love, and please feel free to use that if that's easier for you for any reason. That's a great way to participate in these meetings, and we will read those comments and you don't have to speak. So I see Michelle next on my list. So Michelle Redfield, do you mind telling us who you are?
Yes, good morning. I'm Michelle Redfield. I'm the administrative assistant for the Medical Home Portal, UCCCN, and General Pediatrics.
Thank you, Michelle. All right, Gabi.
Good morning. My name is Gabi Baraghoshi. I'm a QI specialist at UPIQ, and I am really happy that we can talk about UPIQ today.
All right, next is Ashley Dunham.
Hi, I'm Ashley Dunham, and I'm with Utah Human Services, and I work in the Office of Substance Use and Mental Health, and my position specifically focuses on intellectual and developmental disability and mental health.
Wow. Oh my gosh. Okay. So I think Ashley was here last time as well, and we're really pleased that we've got someone from that office who is joining us. That's the new OSAM. Awesome. Is how they're pronouncing that acronym, which I love. Formerly the Division of
Substance Use and Mental Health. Yeah.
Right.
And I misspoke. It's the Department of Health and Human Services. It's been a year and I'm still not used to it.
Oh, I think it takes until the next merger for us all to get used to the new acronym, but we're really pleased to have you, Ashley. And we love the folks in your office. We have Leah Coburn and Eric Tadahara and those others they're involved in a lot of the things that we do. And whenever they're able to come and speak with us, we benefit so much. So we're really pleased that you're joining us, and love that we're seeing your face as well. So welcome. Welcome, welcome. All right, Athena.
Hi, I'm Athena Parker. I'm the Support Services Manager with the Medical Home Portal.
Good morning, Athena. And how about Daniela Ramirez?
I'm Daniela. I was just recently hired at the University of Utah Pediatrics Clinic as their patient care coordinator. I'm really excited to be part of this group.
Oh, that's fantastic. And Daniela, you're are you located, which clinic are you located in physically?
At the pediatrics clinic. I'm currently still orienting, so I'm currently in Farmington right now, but
I see. Okay.
I'll be at the peds clinic.
Is that the hospital location?
Yes.
Okay.
Yes.
Good luck with that. There's a lot of construction and everything going on up there. So
Yes.
so welcome. We're delighted to have you. We're delighted to have you. Great. All right. And Dora.
Good morning, everyone. I'm Dora. I'm the Professional Relations Coordinator for Shriners Children's in Salt Lake. I just assist the case managers and providers with any assistance they need with referrals at Shriners Children's. Thank you.
Thanks, Dora. We're glad you're here. Dora is a terrific resource. So if you ever have questions about what the services are at Shriners Children's, she's a terrific person to ask. And if you need her contact information, just let me know. All right, how about Dusty?
I guess I'll turn the camera on for you. Hi, I'm Dusty Frisbee. I work with Wasatch Pediatrics, and I am the medical home administrator. So I kind of oversee all things medical home for our organization.
So good to see you, Dusty. She's a little bit of a legend around here for those of you who don't know. And we're so pleased to have Dusty join us. So good morning. All right, Erica Wall.
Hi, I'm Erica Wall. I'm with Eric's Group Integrated Services. I cover Duchesne, Daggett, and Uintah counties.
Welcome. Good morning. Glad you're with us. Evelyn Hernandez. Oh, she's in the chat. Great. My name is Evelyn. I'm the care coordinator at Utah Valley Pediatrics in the Cherry Tree office. We're glad you can join us this morning, Evelyn. And even happier that you didn't have to drive into Salt Lake. So that's the upside of the virtual format. But we do miss seeing everyone in person, particularly our Utah Valley Peds folks. All right, Heidi Bates.
Hi, I'm Heidi Bates, and I also am a QI specialist with UPIQ. So,
I hear from Heidi this morning. So glad we do. Welcome, Heidi.
thanks.
Ileana. Ileana's muted right now, so she might not be able to talk. Well, I know that Ileana is with Southwest Children's Clinic, and she runs things there tremendously. And oftentimes she's also got someone else with her, Janet. So hopefully we've got both Janet and Ileana with us today. All right, Natasha Kelsey has put her information in the chat as well. She's a new care manager at Hillcrest Pediatrics. Unable to use microphone and camera at the moment, no problem. And welcome, Natasha. We're delighted that you're joining us. All right, hey, Chanel, will you introduce yourself?
Good morning, I'm Chanel Ekman, and I am the Senior Technology Specialist for the Medical Home Portal.
And we're happy that Chanel's going to start joining us in these meetings. She also does a variety of things that help support the Utah Medical Home Portal Services Directory, which of course we hope is a valuable resource to you guys. And we look to these meetings to learn about new resources. So that's part of the reason that Chanel's here, is so that she can be listening carefully and make sure that that directory is up to date and useful for you. All right, Tani Dunn has put her information in the chat as well. She's a nurse at Northern Utah Pediatrics and not able to use her micro camera either. No problem. Tani, we're happy that you're here. That's terrific. Okay, Tina. Tina's muted.
You didn't have to remind me.
Yeah.
I'm Tina. I am first and foremost a parent of a 22-year-old who has multiple disabilities. And I've worked with the medical home portal for about 11 years. And I also, my other day job is I'm a parent consultant with Utah Family Voices, which is a project under the Utah Parent Center. We're a family-to-family health information center. And we're also a resource for all of you care coordinators. If you are stumped on a case, give us a call and we'll see if we can help out.
Fantastic. Thanks for being here this morning, Tina. And Amy Boyd.
Recording in progress.
Okay. My name is Amy Boyd. I am a QI specialist with UPIQ, but also with a different organization called UDAC, University Developmental Assessment Clinics.
Thanks, Amy. Got a little bit of feedback there. So yeah, maybe, I don't know. Audio is the trickiest part of these meetings. There is no doubt. Welcome. We're so pleased to have you join those teams, Amy, and to join our meeting this morning. I'm going to do a quick look back at our participant list, which shows up alphabetically. So I think that Amber, if you're able to introduce yourself, we'd love that. Amber's in the chat. That's right. Amber is with the ISP team, and she's a care coordinator in San Juan County. And we're so grateful that we've got great folks like you in some of the more far-flung areas of the state. I know that Eric, who is the program manager for the ISP program, can't make it today because he's involved in a block grant review, which is a kind of a big deal. And we'll miss him, but we're very happy for the members of his team that are able to be here. So welcome, Amber. And Anna, please. Anna, are you able to introduce yourself?
Hopefully. So I'm Anna Dees. I work with Tina on the Utah Family Voices project at the Utah Parent Center. I am a parent of 2 kids with a rare genetic disorder, 4 kids total. And I've been kind of kicking around the medical home portal since, gosh, the CHIPRA UPIQ forever ago. I was a parent partner at Hillcrest Pediatrics for a long time, and my kids are still patients there. So I'm excited to hear that we have a new care manager.
Yeah.
Exciting.
Small world happening here. That's terrific.
Yep.
Well, we're really pleased that you're joining us this morning, Anna, and I'm going to make sure that you get a few minutes this morning in our brainstorming section so we can talk about the case that went out to the listserv yesterday.
Perfect. Thank you.
All right, fantastic. Well, I apologize if I've missed anyone. We're going to go ahead and jump into our meeting now so that we don't miss any important things. So let's talk about emails. And one of the things that Michelle and I do is work with email lists for a variety of things that we do, and we use Constant Contact for some of those. And we've recently learned that Constant Contact does some dumb things, and we had an inkling that it was problematic. Now we have more evidence as to just exactly what's going on. So I don't know exactly what that's going to mean going forward, but you've probably noticed that you're getting double emails, one from Constant Contact that might look a little prettier if it gets to your inbox, and the other that comes through our listserv, UCCCN-meetings at, and then the end part comes from the University of Utah. So we're trying to figure out the best way to make sure that you're receiving the information about UCCCN and anything else that's going on related to it. So that's why you've been getting potentially double emails, or you're getting ones that look a little strange that we've copied from Constant Contact and put into the listserv format. And we'd really love to hear from you if this applies to you, that you weren't getting emails and now you are through our listserv. We'd love to know that. That's going to help us to go in and fix the problem. So if you're able to get back to either Michelle or myself with that information, that would be super helpful. But just know that we want to reach you. So we're going to be doing our very best to figure out some of these technical issues that have to do with spam flags and firewalls and things of that nature. So that's that. And then I wanted to mention the survey that you hopefully also received via that listserv email address. We sent it, I think, on Friday, and we'll be sending it one more time. I just wanted to bring that to your attention, that what we're trying to do there is to ask a couple of questions. That's great. I'm looking at Tina's comment in the chat. Okay. We're hoping to understand if you would attend this meeting, if you would attend it more, perhaps, if professional development was somehow made clear to your organization that you were learning and developing by attending these, and or continuing education credits, which are a little bit harder for us to do, but potentially something we could do if they have value. So that's the thing that the bulk of those questions is asking. And then we'd also like to find out if trying to utilize a tool out there that's that already exists and that many of us will be familiar with, a private Facebook group, if that might be something that would be helpful to engender conversations and questions and networking in between meetings. And so we would love it if you would respond to that survey email. It won't take very long. The questions are pretty straightforward, so we'd really appreciate that. So we'll be sending that out to those who haven't. Well, we'll probably just be sending it out again. And if you got it the first time and filled it out, disregard. And if you haven't, please do it. And of course, many of the people who we're hoping will respond are the ones on our list who don't come to the meetings. And so, all right. Next, we'll do our monthly reminder about the Spark Autism Study, which is a pretty cool thing. And it's really neat that the University of Utah is involved in this, because it is a nationwide research study, genetic research study, that over time, many of the other sites fell out because they weren't doing enough, I guess. And Gabi and Heidi can speak to this more, but
yeah, it's a very cool study. So it's very simple, families sign up for this and everything is done online and in the comfort of their home. And actually so the University of Utah, we are in the top 3 recruitment sites. So thanks to the providers out there, care managers, care coordinators, and word of mouth advertisement, I believe. Yeah, that's how you say it. So if you need more information or need brochures in your practice, please contact us, contact UPIQ or Mindy. There's many ways to get in contact with us. Thanks.
Yeah. So yeah, the folks who participate in this actually do get like an Amazon gift card. So even if they don't get anything else out of it, they'll get an Amazon gift card, and it's really simple. But they could learn a whole lot more about what's going on with their families via the genetic information. It's pretty cool.
Mm-hmm.
All right. So Project Echo, boy, we're doing a lot with this, and we want to make you aware of it. I better be watching the chat. I hope that you're watching the chat too, Michelle, for me, because sometimes I don't multitask very well. The Project Echo fall session has kicked off, and in fact, it's been kicking off just brilliantly with a lot of Shriners presentations, and we love that. So we got started last month, and we've got several more coming up that I've got here listed on the screen. We're also doing a number of presentations this fall around transition to adulthood, and we're excited about that. So we've had one of those already, and we've got another one coming up early in October that's going to be talking about guardianship. So we hope that if that's doable for you to join us, that you'll consider doing that. Otherwise, don't worry, we have these all recorded and we get them posted almost immediately on the Pediatric Project Echo page. That link will go out in the meeting summary. And if you can't find that, just ping me and we'll send it to you. But that's something else that Chanel helps us with, and we really appreciate her technical support in getting those things posted so that you can watch it after the fact. All right. Okay, so a couple of updates. Wanted to let you know that we have a new page on screening for eating disorders, and I am going to show that. There we go. So this is something we've actually wanted to get on here for a long time, and we're really pleased that we've got it going now. It's a fairly brief page. You can see some of the sections of it here at the top. Let's take a look, for instance, at what to do with a positive screen. So we've got a lot of links here that can help you help your providers to know what to do next around that. And services and referrals, we've got some providers that come out of our Utah Services Directory for the Medical Home Portal that can be helpful. And then we've got some other resources down at the bottom that might be of help as well, including guidelines, associations that are support, a guide to medical care. And we actually partner with Montana, and they have a grant right now around access to mental health care for children and adolescents. And they've been doing echo presentations around this as well. So we've got some slides from their echo presentations as well. So I just wanted to make you aware that this is a new page that we hope will be of value to you on the Medical Home Portal. We've also got a number of things underway with our families content. We're really pleased that we've got Anna Dees now a part of our team. Tina's been amazing. However, Tina's got a lot of new things going on in her world, and Anna brings to the table a really interesting and robust background that has to do with mental health and wraparound services. So we're very, very excited about her expertise and what that's going to bring to the family side of things on the Medical Home Portal. So you'll start to see a lot more in these slides going forward. All right. Okay, so this is our brainstorming time. This is my favorite time, and I am really appreciative that we actually had a case that got sent out to the listserv yesterday that came via Anna Dees. And so I'd love to take just a few more minutes this morning to talk about that. But I don't want to use up all the time if other people have other cases that they'd like to talk about, or new resources they've come across, or anything else. That this is the sharing time. But Anna, do you want to take just a couple of minutes and remind us of the details of this case?
Yeah, so I got a call from a case manager up at Primary Children's that is assisting a social worker. We have a youth undocumented, so that's the big barrier to Medicaid for him. They had him on emergency Medicaid for like 30 days post-surgery, has an anoxic brain injury after a near fatal drowning, ended up in a wheelchair. The family doesn't even have a family car. Resources are really, really, really tight, and they've reached out to every single self-pay option that they were able to find, and most of them were in the $400 to $500 range just to get him from the hospital to Orem, and they've got to be able to get him back somehow. They've applied for FlexTrans, but it could be 90 days before they could get FlexTrans, and they're not sure if mom can even ride FlexTrans, which I had not heard of. So they're just looking for any services that we might have come across or resources. I think we may have to throw out a plea to the wheelchair van moms. Tina, want to drive to Orem? I don't know how else we're going to get this kiddo home. And there's bigger concerns, once they get home, but they just are trying to get him home, and he's 14 and a big dude, and mom's a little bitty thing. So any ideas? And Mindy sent me the ideas this morning, so I forwarded those on to Camille. Hopefully we can figure something out.
So
I just
yeah.
read-
Oh, go ahead, Tina. I just wanted to make sure that we knew what had come out of the listserv as well. And so there were a number of fairly helpful
Yeah.
or potentially helpful comments that came through that, and we appreciate those.
Absolutely.
Yeah, this is a hard one. I know that there's a service out there that's kind of like Anna, you've seen it. It's been passed around work. It's kind of like a Lyft or an Uber.
Oh, the Izzy app, Errand.
Yeah, but
So I
probably
reached out to
good.
them. They don't have wheelchair vans. Yeah.
Okay.
Yeah.
And then I just put two in the that we might want to pull up and just take a peek at. There's Cars That Care and Cars for Moms. And I don't know if maybe we could get the coordinator to work, to call, or well, actually it's Anna. We could get Anna to call and
so I've worked with Cars That Care in the past. It would be worth putting in an application for a long-term solution potentially, because they have provided a former client with a wheelchair van. It didn't last very long. They're great. They meant really well, but I haven't heard of Cars for Mom, so I will look at that.
And Ashley has put something in as well. Ashley, go ahead.
Yeah, so I haven't replied to the email thread because I was waiting for one more partner to get back to me. But we had a few different suggestions. Someone suggested reaching out to Ken Garf, or I'm going to mispronounce this, Marcosian Auto.
Marcosian, yeah.
I guess in the past they have done some kind of community charitable actions for families that are in need. So they suggested reaching out to those two dealerships. I did put a nonprofit organization into the chat. There is a fee associated with it. So again, it's probably going to be fairly expensive. And then the last one that I was waiting on is we work with the Multicultural Center.
Multicultural Counseling Center.
Yes. And they wanted the contact information for the family, and I told them I couldn't provide that.
So I referred them, that was my first thought, because their peer supports will do just about anything, whatever needs to be done in the community, regardless of cost or fees or anything of those sorts. So that was my first thought. So they were going to reach out to, they're a great group.
Awesome.
I knew if they had heard of this family that they would do everything they could, but I just don't know if the wheelchair van is within their purview. So I left a message for Jeanette over at the counseling center to see if maybe.
And they also have a lot of connections with Spanish speaking organizations and foundations. So I kind of was assuming they would find, if there was a way, they'd find it.
That was my thought too. Yep, that was exactly my thought. That's what I told this caseworker. I said, if anybody could pull this off, they're the people, because they're great.
Now, even if we could locate a van, there's a chance that Independent Living Center could do the lift. And, I mean, I don't have a wheelchair van at this point in time. I used to, but Adam can actually get in and out of the cart easy enough with a little help. So we've been, pushing that. But I mean, you can put a kid in a car seat, and
that's what I asked her about,
and throw the wheelchair in the back.
Right.
But then Independent Living Center would be the one to help fund that lift. And so like when we got our van years ago from Carl Malone, it was just a van. And then we worked with Independent Living Center to put the lift in. And they have funding depending on, how quick it goes through the year. But they were the ones that could help with that.
Yeah. Well, and my thought was, even with the tracks being right there at Primary Children's, could we figure out just transport from the track station in Orem home? Is he stable enough to be on the tracks that long. So those were kind of some of the things that they were looking at, but this is great. I'll look into the destination services and see if that's something. I'll call multicultural counseling again. And I'm wondering if maybe, oh, Tina, what's the Provo Independent Living Center? Ability First. I'm wondering if Ability First might be able to pick them up at the track station in Orem and just get them home.
If they've got a vehicle, yeah. Because the tracks is perfect for a wheelchair. Our kids we've got 5 kids in our classroom that ride tracks all the time with their wheelchairs, and they're pretty complicated wheelchairs.
So this is Heidi. Sorry, I'm having bad internet issues. But what about, because the tracks doesn't go down there, it's the front runner, right?
That's right. They would have to transfer at a transfer station.
To do that.
Right.
Did you get my information about 2 insurance people that would help try to get him coverage, to get him Medicaid, special Medicaid? It's Take Care Utah, and it's the Healthy Policy Help.
Yeah. So because he's not documented,
right?
I think that is the barrier. Because
right, but those 2 organizations can help him because he was hurt here in the U.S. I've used him before. I used to work at the refugee with a Redwood Health Center, and I worked with many undocumented.
Okay.
So I would really
circling back to Medicaid.
Yeah,
okay.
Because those 2 can probably get some sort of like emergency Medicaid in the process just for him.
It sounded like he had been on like a 30-day emergency Medicaid, and that had just ended. And so they were only working with Motive.
Right. But because he has now a lifelong disability.
Yeah.
This company should be able to, these 2, they specialize in this. So.
Yeah. Take Care is great. Okay. So we'll circle back to Medicaid. That's helpful.
Okay, and this is something that Chanel said she just added into the Utah Services Directory yesterday. It's Stellar Transportation. Chanel, where did you learn about this? It came through a suggestion?
Yeah, it was came through our suggested provider queue. So they do have stretcher and wheelchair non-emergency transport throughout Utah.
Okay.
Awesome.
Ooh. My goodness, fantastic. All right. It's actually 9:04. I am curious to know if there's anybody else who would like to talk about a case or bring anything up. Don't want to monopolize the time. If anybody else has something they'd like to mention, this is actually really helpful. I know that transportation is something we talk about in this section of the meeting a lot. It's like a puzzle, right? It's like a mystery we have to figure out with these things. How can we help the family? Yeah. All right. Sounds like nobody else wants to bring anything up. I'll just throw out a plug though. It's watching what happens when we send out a request for help on that listserv that is just so amazing about this group, and we really appreciate everyone jumping right in to try and help. And it seems like it's going to happen for this family, but I'm so sorry that they're going through this, and it's just so wonderful that there are places that someone like the care manager from Primary Children's can go and know that they're going to have some responses and some brainstorming. So thanks everyone.
Good partnership.
Absolutely. It takes a village, and I think you guys are that village. Wonderful, wonderful. All right. So this is also something that we like to do at this time. I'll just remind you that we love hearing about anything you're doing within your practice that is moving the needle, and motivational interviewing is something we talk about. We try and talk about it annually in a little more depth. And in fact, we're going to talk about it and do a little more training in November. So I'll let you know that our November meeting will be around motivational interviewing skills. And I am very selfishly looking forward to that because motivational interviewing is a tool you can use in every part of your life, not just when you're working with families that might not be fairly open. So it's a really cool tool that you can take advantage of all the time, like with your teenagers. And also quality improvement wins. That's what we get to talk about next, is what exactly is quality improvement. And so with that, I'm going to turn the meeting over to our UPIQ folks. And I can stop sharing and let Gabi and Heidi start sharing.
I hope we
Except
won't.
not Heidi, because she's having, it's just Gabi.
All right now.
Well, I'm here. I'm getting this malware, so I can't pull up anything on Google. So I don't know how. I have my phone just in case, but
Okay.
yeah, I gotta call IT when I get off. So
Yeah.
sorry, Gabby.
All right. Let me see. Okay, I'm sharing. Okay, everybody can see the slides. Yep.
Okay.
All right. Well, Minnie, thank you so much for giving us the opportunity to talk about UPIQ and what projects we are currently working on. It's always fun about talking that. We have no conflicts to disclose, just to make sure that there's something always popping up. I don't know where it is. Okay, so no conflicts to disclose. And let's go to the next slide. So here is what we would like to cover today. So first of all, who, where, what is UPIQ? So I would like to go a little bit into the history of UPIQ, introduce the UPIQ team to you. I will spend a few minutes on what quality improvement is. And Heidi and I want to list some of the projects UPIQ has worked in the past, what we are working on currently, and potentially upcoming projects. And in the end, we will have some time to answer some questions you might have regarding UPIQ or regarding some of the projects you will be hearing today. Okay, who, where, what is UPIQ? So UPIQ stands for the Utah Pediatric Partnership to Improve Healthcare Quality. And we are a quality improvement partnership and a part of the National Improvement Partnership Network, also known as NIPN. So there are over 20 states that have developed an improvement partnership, and they are part of NIPN. So all these partnerships, we all have the same goal. So, and that is to advance and transform healthcare for children and their families. So here's just a map to show you how widespread NIPN actually is. And I put some of the logos on there. So logos of this partnership, quality improvement partnerships. And maybe you already have seen some of those logos besides UPIQ in past projects you did, or in upcoming projects you're going to do. So I thought it's a nice colorful slide. Okay. Let's dive a little bit into the history of UPIQ, and it's only going to be a very short history. So UPIQ was established in 2003. It's hard to believe that we're coming up on our 20-year anniversary. And it was established by Dr. Chuck Norlin and Dr. Paul Young. And Dr. Chuck Norlin was the acting director. And he retired in 2017, and then Dr. Diane Lu took over. So from the beginning on, the goal and mission was and is very clear on UPIQ. So we are trying to promote evidence-based practices and assisting healthcare workers in implementing quality improvement at the practice level. And UPIQ provides education and guidance. We provide quality improvement tools, ongoing support to help to bridge the gap between knowing best practices and consistently implementing them in practices. And of course, with every quality improvement project, we are helping to develop measurements. Okay, So here's the current UPIQ team. So we have Dr. Diane Liu, and as I mentioned before, she became the director in around 2017, give or take 1 year on that one. Then we have Heidi, and then myself, Gabi, and then we have our newest member, Amy Boyd, and she just joined our team about 2.5 weeks ago, and she will spend 25% of her time on UPIQ projects. So a very limited time, but nonetheless, she will be trained in quality improvement. Okay. Before I go into our projects, I would like to spend a few minutes on what quality improvement actually is. So here are 3 definitions of quality improvement. So one is by the CDC, one is by the US Department of Health and Human Services, and one is by the Agency for Healthcare Research and Quality, also known as AHRQ. So basically, they all are very similar and kind of are highlighted on each definition, what sticks out to me. And what really sticks out to me is they all mention measurable improvement, achieve equity, improve health for patients or for a specific population or for our community. So, and here I list the 3 most commonly used QI models out there. So I'm sure you have heard all of them in your past work. So there's Lean and the Six Sigma. They are mainly developed for use in the manufacturing industry. So the Lean model was developed by Toyota, by the Toyota industry in 1948. And the Six Sigma model was developed by Motorola in 1986. So the IHI, so the Institute for Healthcare Improvement, also known as IHI, model for improvement, was created in 1996 by the Institute of Healthcare Improvement. Sorry, I'm repeating myself over here. So this model is the most commonly used model, QI model in healthcare. So, and UPIQ is following that model of improvement. So here's a little bit more depth into the IHI model for improvement. So the IHI really expands on the PDSA cycles. And I'm sure you all have heard about the PDSA cycle. It's the Plan, Do, Study, Act cycle. And just a kind of a very interesting little information aside. So the PDSA cycle was actually developed by 2 engineers at the Bell Lab in 1939. And those 2 engineers, they used the steps of the scientific methods as a foundation for those cycles. And so if you're the scientific methods and if you compare to the PDSA cycle, so make a hypothesis would be the plan. Test the hypothesis would be the do, examine the result would be the study, and report the result would be the act. So here you have the PDSA cycle. So the IHI model really consists of 2 phases. So during phase 1, so you ask yourself the 3 fundamental questions, and those questions are, what are we trying to accomplish? How will we know that a change is an improvement, and what change can we make that will result in an improvement? So answering those questions will help you to set your aims, establish your measures, and select an intervention. And remember, when setting aims, it's always recommended to use the SMART goal format. And SMART stands for specific, measurable, achievable, relevant, and time-bound. So that would be phase 1. And phase 2, in phase 2, you just, test your intervention by using the PDSA cycle. So here is a map of a typical UPIQ learning collaborative. And as you can see here, we have the PDA cycles really built in into our projects. And projects can actually last anywhere between 6 months, and lately they can actually be up to a couple of years. So it really depends on the type of funding the type of projects we are doing. All right, so here I listed a couple of the past projects, and and within over the last 20 years, there have been many projects, and some of those projects have been repeated several times. And one of the past projects very, repeats almost every year is the asthma projects, and Heidi will talk more about that one. Then we did ADHD, we did the antibiotic stewardship, we did a medical home that was mentioned several times during these meetings already earlier on. We did mental health projects, newborn screening, obesity, toxic stress, transitions, and autism, just to name a few. And current projects, so we are actively working on right now, would be an asthma project, the autism echo project, mental health access and integration, the behavioral health learning network, promoting child development through play, and act early. And so here and below, I listed a couple of potentially upcoming projects, and it really depends if we're going to get the funding for that one. So one of them is the prescription for play, and we are working with the Lego Foundation to get some funding from them. And that's, that the prescription for play project is very similar to the promoting childhood development through play we're doing right now. We just want to, spread this project out to other practices. And we want to target practices in frontier areas and also in rural areas. Then the e-asthma tracker, Utah Early Childhood Project, which we should hear about, I would say end of September, if we will receive the funding for that one. And that's also a multi-year project. And then there is a possible upcoming immunization project. And there we don't have quite worked out the details on that one yet. All right, let's jump into the current projects. Okay, I will start with the autism project, and also known as the Aspire project. And Aspire stands for Autism Services, personalized, integrated, research-informed, and empowering. And so this project, it's also a multi-year project. It's really a collaboration between UDAC. So UDAC is the University Developmental Assessment Clinic, early intervention programs, the medical home portal, pediatric project ECHO, UPIQ, and several other partnerships with other organizations are in this Aspire project. The Autism ECHO, which is part of this Aspire, is, so there are two arms to it. So there's Autism 101 and the Advanced Autism. So Autism 101, that started in February of this year and will go until next month. And what that entails is there were monthly autism webinars led by the Aspire team under the leadership of Dr. Paul Carbone. And just in case you're interested, so all those webinars are recorded, and just in case you're interested to actually, watch some of the recorded webinars, here would be the link to the recordings. Now, the Advanced Autism ECHO. So this is geared towards providers who want to take the autism assessment basically to the next level, like the stat testing. And the Advanced Autism project, actually a kickoff is tomorrow. We have an all-day in-person training session, and that project will go until October 2023. And by the end of that one-year program, providers who participate will receive a certificate that they are trained in a secondary autism screening. And so some of you might ask you, so why do we want to have a pediatrician do a secondary autism screening? Well, as we know, the wait time for children for children who deemed to be high risk for autism, who are referred to specialty clinics, can be quite long. And we know the further, if you delay the diagnosis of autism, the outcome is not as good. So the Aspire team thought if we train pediatricians to do their secondary autism screening, like the STAT testing at the practice, that will cut down on the wait time for the child to be assessed for autism, receive the diagnosis sooner, and get sooner into a program to help the child. So that would be the autism project. Okay, so the mental health access and integration project. So this is also a multi-level, multi-year project. And in year 1 and year 2, so we're in year 3 currently. So year 1, it was really the focus on improving the screening process for mental health behavioral health. So it would be anxiety, depression, and or traumatic stress. So in year 2, our goal was to improve the communication between primary care, the pediatricians, and the behavioral health organizations. And we were very successful in actually improving the communication between the Medicaid population, behavioral health organization, and the primary care pediatricians. Year 3, so this is what we're doing right now. So this year, we really focus on identifying key drivers that will lead children to go to the ED for mental health crises. So what we did is we went around to pediatric practices, to the participating pediatric practices, and interviewed the providers to, to hear their thoughts on why children would go to the ED versus calling the provider or calling, making appointments with behavioral health therapists. And we really, what we wanted to do is find some ideas actually for next year, for year 4, to, find processes around mental health crises management and getting upstream to those crises. Because data shows us that 60% up to 70% of children who are seen in the ED for a mental health crisis are actually discharged to home. So that's, begs the questions. So what could have been done to have the child actually contact the pediatric offices versus going to the ED? So this is just some ideas we're throwing around right now. And so we are still in the process of interviewing some practices, but I'm going to show you in the next slide. I'm going to show you some of the key drivers we already identified on some of those practices. And if you look at those lists, and I know the print is a little bit small, but there's always a recurrent theme. The word lack is almost in every column. So there is lack of mental health providers. There is lack of networking with behavioral organizations. There is a lack of education resources for parents. Care coordinators are not involved in behavioral health care, so in some of the practices. And then, and you can see through here, there's long waiting times to get connect the patient or their child with a behavioral health therapist. So there's multiple key drivers, and so hopefully next year we can really focus on overcoming some of those barriers. Okay, next project is the promoting child development through play project. And so we implemented this project actually at the Sugar House Clinic, at the University Pediatric Clinic, and at the South Main Clinic. And just on a side note, I'm so happy that the University Pediatric Clinic finally has a care coordinator. And Daniela, as soon as you're onboarded, the two of us have to meet and talk about QI projects we are currently doing with UPC. That's on a side note. So this project basically is the prescription for play. We are trying to get funding from the Lego Foundation. So studies have shown that that children's development is so much better if parents spend 50 minutes a day to play with their child. And so the Lego Foundation provides pediatric practices with kids, like this little duck. You can see this on, let me see if I can get my cursor to work some here. Like this little duck. So the practices will get kids with the Duplo blocks in there and an educational brochure. So now it's up to the provider to educate the parents on the importance of play 50 minutes a day, and also on what types of play the parents can do. And so, as I mentioned, we just barely implemented this project in UPC, South Main, and Sugar House Clinic. And our focus for the month of September was to implement a documentation process for the provider, that the education was given, and also that the blocks were handed over to the children. So we don't have much data to show yet for, but I think it's a very, very exciting project. And so if you guys or practices who would be interested in participating next year, please reach out to us. All right, then let's go for one. Okay, the Act Early project. So Learn the Science and Act Early is a CDC program, and you probably have heard about that one. But the Utah Department of Health and the South Main Clinic, they are working together on this project. And UPIQ got involved in creating some measures around the Learn the Science and Act Early program. And so the measures are listed here. So the first measure is, so we decided to focus on the 18 months, on the 24 months, and 30 months well child visits. And the screeners that should be used on those well child checks. And it would be the POSI for autism screening and the SWIC. And so that would be the first measure. And the goal was set at 95%. And within actually 2 months of the project, South Main Clinic already exceeded their goal. So they did really an awesome job on the screening process. The second measure was, is there appropriate follow-up documented on the children who failed the SWIC or the POSI? And the appropriate documentation, follow-up documentation, can be that a provider recommends retaking the screening in a couple of months, or the provider, after interviewing the parents a little bit more in depth, deems the child not at risk for autism, or the provider says, yep, the kid is at risk for autism, and writes a referral for the child for the UPIQ clinic or for early intervention clinics. And now the third measure, which will be implemented actually in October, is the follow-up on the referrals. So we are going to look back in January, the first 6 months of the year of 2022, on the children who were referred out to specialty clinics. Was there follow-up with the care coordinators? Are there some notes written by the specialty clinics in EPIC? And so the management of South Main Clinic and UPIQ are still kind of discussing on how the measure should look like and what you're going to look in type of documentation in EPIC. And with that, I will hand it over to Heidi. And Heidi, I will stop sharing so you can share your own.
Okay, just for whatever reason, I cannot share. Well, because I'm having I can't share, but I can't do. So if you can forward the slides for me,
I will. You just let me. So
I will. So hi again. I'm Heidi. I'm with UPIQ. I joined UPIQ probably right at the beginning of the pandemic. So I've had a great time. It's been real. It's been fun. One of the reasons I love UPIQ is I've been a pediatric nurse for a lot of years, and it didn't matter where I worked, whether at primary children's or in clinic. I always found that there was a gap in care with kids, and maybe that's because pediatricians, they usually just see kids from 0 to 18, and then for the rest of their life they see a family practice doctor, and that's my dog. Sorry. Oh dear. And I just kind of found like kids kind of always fell through the gaps, especially medically complex kids. So that's kind of why I honestly, I approached Gabi right after my predecessor left, and I was like, hey, when you guys are hiring, you call me and I want to apply. So it's great. Like she said, the Asthma Learning Collaborative is probably the one that's the most, I wish she would stop barking. It's just going on, right? The reason why it is because number one, it's the easiest one, meaning that doctors can really see a change from month to month. Sometimes it takes it takes a couple of months to get a process going, where this asthma is like, once we get a process in place, you can actually see the changes and you can see your numbers increase. So that's why I'm saying it's really ideally the easiest one. Gabi has also mentioned we offer MOC part 4, but also this year we got permission to offer CME for nurse practitioners and PAs. So that's a big movement. I think that's a group of clinicians that haven't really focused on because of that. They all want their CMEs. So this year we're happy to say that we can offer that, and next year we'll apply for it at the same time. This is just a handful of clinics that have joined us since I've been working. I know that there's been more, before me, but so this is great. We are partnered with the Department of Health. I do sit on the Utah Asthma Task Force, and I was going to pull up some stuff about them, and also we'll talk about more about the stock albuterol and things like that. But just so you know, we also partner with Green and Healthy Homes as well. So, all right, next slide, Gabi. Okay, so when we do the Asthma Learning Collaborative, we always have 2 main core measures, and that's always the percentage of patients that are assessed by using a standardized tool, and that can be the ACT or GINA. We find that the GINA is used mainly before the age of 3, and then ACT is easier for kids and adults 4 and up, right? So then there's two types of ACT, so 4 to 11 and 12 and over, and then also number of patients that have a current asthma action plan or some sort of asthma education on file. We're finding that this measure is the hardest to get, and so we're finding that the breakdown might be just between EMRs. How do we get it easily for the provider because they only have a certain amount of time, and how can we give it to the parents that they actually walk out with it? So we're working on that. We're going to focus on that really hard this cohort with me. And then we also have balancing measure, and this is just a survey at the end. Those that want MOC Part 4, or really anybody, just how they thought it went, their care, their effort. It's just a really good defining tool if they were ready for QI, and how it affected their clinic, how they felt like it affected their clinic. So it's always good for us to see that. Okay, next slide. This is just from our last A3 that I submit to the Department of Health. You can see here the first graph, everyone started at baseline. So 20% of kids, and the baseline is we go 6 months prior to the start of the process. So we start in December. I usually have them pull 6 months of data, and it's usually a random 30 charts. We see where they're at, and you can see here their baseline was 20%. So that was a little like eye-opening for them, because a lot of them thought, oh my gosh, I'm doing this every patient. Clearly they're not. But it was really great to see that it really peaked in January, kind of fell a little bit in February, but we also saw this was last year, one of the first years going into COVID. So we saw that drop off a little bit because I think they were focusing more on COVID. And then once we realized COVID and asthma probably kind of go hand in hand, we kind of see it go, level off. And that's the same with the asthma action plan. I was happy to see that it was a slow climb to find a process that worked for each clinic. But when we got up there, we got above our threshold of 80%. And again, this is aggregate of clinics. So this is not just one clinic. This is an aggregate of like 3 or 4 clinics during COVID time. So it's good stuff. Okay, next slide. Okay, this one, stock albuterol is one of the reasons why I want to focus on asthma action plans in this year's collaborative, because in 2019, the state legislature did pass House Bill 344, and it allowed the schools to have stock albuterol for students. And it's much like the EpiPen. And it's for kids that have a diagnosis of asthma not by their parent, but by a doctor. They have to have a current asthma plan on file, and that they are having respiratory distress, or they're showing like in the yellow or red zone in that asthma action plan. As we're pulling the data through the asthma task force, we're finding that only 10% of schools have implemented the stock albuterol. It is up from 34 from the last year, so that's good, but we need to really increase that. So we're trying to find ways with the task force to get this out, see if we can get more schools involved in this. And what it is the state gives the school money to buy the stock albuterol to keep it there. There is training, and this is for the nurses to get the school nurses, and we all know not all nurses are in the schools, right? So it's also for any admin person, and they have to take a test and pass, and to do that. We also found that only 6.2% of children that have asthma, or 6.2 children have asthma, but only half of those have an asthma action plan, which means when we pulled the numbers, it was like there was 15,000 eligible children in schools, but only 7,000 of those, and that's statewide, and only 7,000 had an asthma action plan on file. They talked about a kid that the child it was a yellow day. They've also implemented the flag protocol, which I wanted to pull up and show you, but I'm going to send to Mindy to send out. The kid came in clearly respiratory distress, moved from the yellow zone to the red zone. They could not call, they can't call 911 until they get a hold of a parent. He had forgotten his albuterol inhaler. So the kid was in respiratory distress for 30 minutes before they could get hold of a parent to get an emergency EMS to take him to primary children's. That is just scary. And when you go back and talk to the school people, they were very like, their hands are tied. They don't have an asthma action plan. We have the stock albuterol. We can't give it to him, and we can't call EMS until we call the parent. So that's why I really want to focus on asthma action plans, this cohort, to get it going. All right, Gabi. My next project was the Children's Behavioral Community Quality Collaborative. That is a mouthful. What this was, and this was interesting, this kind of really helped me work with a group outside of doctors and nurses. These were all clinicians or providers for mental health. You can see here the Children's Center for Healing Center, Animals for Healing. They were the Utah, what were they? The Utah Healing Center, I think that's what they were. And then they just changed their name. They just got another dog, so they have 2 dogs, and they have horses. It's awesome. Latino Behavioral Health Services, I found out about them. They are amazing. And then of course I worked with Health and the Department of Human Services. I think they're going to be changing their name too, but it's the Juvenile Justice System. So it's great. Of course, Intermountain, Wasatch Canyons, Vibe Treatment down in St. George, and Lighthouse Counseling there. So this gave me the opportunity to work with another group of clinicians that had no idea they had an idea of quality improvement was. They didn't know how to start it. They didn't know how to identify. Each one of them knew they had a gap, but they didn't know how to identify a process to fix that gap. So it was great to work with them to figure it out. Next slide. I want to see what the next slide is, Gab. Oh, there you go. So what we did is each one of these groups, this is what they wanted to focus on specifically. So the YOQ, how to use that measurement to their advantage. So it was standard across the board. The YOQ is it's an outcome measurement that is given to kids to help guide treatment of care. it is a standard, or it has to be a standard if they're Medicaid base. So what we were finding is that they had to do it, but they didn't know where to record it, and they didn't know how to use it to the child's benefit, how to drive treatment, how to drive the direction of discharge and when to discharge. So that was pretty cool to learn about that. And then we had some that didn't even know about the YOQ because they weren't Medicaid based. So we had to help adopt something like the YOQ. So we came up with some outcome measures that helped drive their treatment. Latino Behavioral Health Services, we worked on streamlined referral process. This is a great group. I want to make sure that they're on the medical home portal. They are a very passionate group that does serve the Hispanic community. Because they use peer support. If you're not, I think with peer support, these are people that they go through training, but they've been there, done that. So these are individuals that have had suicidal thoughts, that have had, that they've been on drugs and alcohol, and they're the peer support for other people that are struggling in that Hispanic community. So they're an amazing group. We worked on bidirectional communication. We worked on, a lot of them didn't realize, like, we can call MCOP, but what do they do? Like, they get here and then they're like, no, they're fine. Or what is the process is when primary children's discharge? What is that process? What does that look like? Why are they being sent here? We need them, so it was a really good talk. And then the one group, Vive, they were really integrated. They used the IHA process. They were able to save 1 FTE. They figured out that they were like too many hands in the cookie jar. So they were able to streamline a process for admit to discharge, and they were able to save 1 FTE in money. So that was great for them. Next slide, please. Oh, the eAsthma tracker. This is another one that's it's a good tool. It really is a good tool. It is patient driven. Intermountain Healthcare, I know Castile is doing wonders with this. They're really working at it. The patients love it. We are trying to implement it here in the university group, but it's just taking care of patients via a tracker. It is a web-based application, so it's not an app on your phone per se. You can download it to your phone, but it's web-based. And it is a communication tool between the provider or the clinic and the patient/parent. Go ahead, next slide, Gabi. So what they've done, this is from Dr. Brian Stone and Florian Acoy at Primary Children's. This has been going on for quite some time, but what they did see is that this eAsthma tracker, it did improve asthma control over time. It improved their quality of life. And these 4 red arrows, this is exactly why we do a QI thing, right? Because we're finding that they have missed school days, which miss work days for parents, and that's not good. So, and then it reduced the need for oral steroids, reduced ED and hospital admissions, and reduced healthcare costs. So we know that this tracker is a proven tool. And you'll know, we'll go over it through our asthma initiative this year again. So it's a great tool. All right, next slide. Let's see what my next one is. Oh, that's it. I did want to put in a plugin for Spark because I was going to actually pull it up. With Spark, you not only get kind of, your Amazon gift card, but you get webinars. There's free webinars, there's free newsletters, there's free surveys. And each time you fill out a survey, the parent or the patient, the kiddo gets some more money. These webinars, like last webinar was, can't even think, it was about autism and puberty. So it's for parents. They can listen to this webinar from these medical doctors that specialize in autism and get that. So it's not just they swab or they spit and you get a genetic code per se in years, but you get so much more with Spark. I think I have learned a lot. I mean, I have a child that has autism, and he'll be 18 in November, but I have learned, I'm watching these webinars and reading these newsletters, and even the providers that sign up, they get newsletters. They can have access to these webinars. So it's really beneficial for the parents as well. All right, Gabs, I'm done.
Thanks, Heidi. Hey, so Athena said the Latino Behavioral Health Services are on the medical home portal. And I just have one question regarding the asthma action plan. So, you mentioned that the majority of asthma children do not have one on hand in school.
Yeah.
So what type of asthma action plan is accepted by the schools, and how can we help practices to get that done for the patient?
All right, good question. So I was actually going to pull that up as well. How they are working on, so the Department of Utah Department of Health, and also the school Betty Sue, they have an asthma action plan. And it has that little down at the box that says, yes, if it's very specific to the Department of Health and to asthma. However, we're finding that some of the schools have not adopted that asthma action plan. And so there's other asthma action plans kind of floating out there. So we're getting one asthma action plan that's going to be adopted for all the schools. So it's one standard. And then that way the doctors can fill it out, give it back to the parent can give it to school. So that's kind of where we're also finding that process breakdown, is that the doctor's asthma action plan that they have is not acceptable at that school, because it doesn't have the lettering down at the bottom that says you may administer, here's my signature, type of thing. Yep. So that, and they are working on other languages as well. So yeah.
Thanks, Heidi.
Yeah.
All right, so with that, we would like to open up to any questions or comments regarding UPIQ or any of the projects you heard. So the time is yours.
Well, I thought that was terrific. Thank you, you guys. I'm always motivated when I hear about the PDSA cycles and measuring. I wonder if you all have had the exposure to the SMART goals acronym, but I'm always reminded that it's so important when we set goals, whether it's for ourselves personally or around things we want to improve in our work environments, that we often do things that are just not attainable for one reason or another. Maybe you didn't even write them down, you just thought about them. Well, that's probably not gonna work. But SMART goals are, do you want to just rattle those off again for us, Gabi?
Yeah, SMART, so it has to be specific, measurable, achievable, relevant, and time bound. So you got to probably set a time when you want to achieve that goal. Otherwise you might go on for ever and ever and ever, and you will never get there.
Right. And I think the achievable one is always really important to me, because specific, I think, we get that you want to say precisely what it is you're trying to do. Mm-hmm. Measurable, that makes sense, right? We want to be able to say we're here now and we got there. But achievable can be a little tricky, because sometimes we shoot too high, and
you're right, Mindy. And the thing is, that's where UPIQ actually steps in and pull the providers back down to the carpet, basically, and says, okay, let's start slower, let's make a smaller goal, or, don't be so ambitious, and we can go from there once we reach the first goal. So, yeah.
The other thing that I love about PDSA cycles is that there is this idea of, oh, that didn't work, no big deal. Let's take what we learned, let's tweak it, and let's keep going. So it's a very optimistic model. And I'm always energized and jazzed after.
Yeah, no, that's good. And then also, keep in mind the word failure. You says, oh my God, I failed. The PDSA cycle, we analyzed the result and we actually got worse. There is no failure in PDSA cycle. It's just a learning opportunity. And then let's try something different. So, yeah.
I always find that people, when providers are like, I'm working with one, she's like, I can honestly say we have not ever been doing that. And I'm like, hey, we can only go out from there. I love a zero baseline, right? We can only grow from that. So that it made her feel a little bit better about it. So it's
And Dusty, thank you so much for the kind words. And yes, I would say UPIQ and Dusty go back a long way. And yeah, it's always a pleasure working with Wasatch Pediatrics, specifically with Dusty.
My guess, and I don't know, but I'm going to go out on a limb a little bit and guess that maybe some of the people who are on our meeting here today wouldn't feel like they're in a position to make the decision for their organization to participate in a UPIQ project. But I just know, is there any advice that you guys have if somebody is potentially interested in one of these topics and wants to do more, but they don't feel like it's their place, or maybe they haven't been there long enough? Or
well, they can reach out to us, whoever's on the call today, or whoever's going to listen to the recording of this meeting, they can reach out to UPIQ, to Heidi or me, or to Dr. Lou, and we can actually take it from there. We can assess the clinic and then, email to the providers, say, hey, this is an upcoming project. Would you be interested in participating? So if the person does not feel comfortable approaching the providers or the office manager at clinics.
Great.
And also the UPIQ services are free. We do offer right now, we do offer, there is a fee required for if they want MOC, because there's certain boxes that they have to check. But these, if they're not wanting MOC, if they just want to do a QI project, it's free.
Yeah, and so MOC, and maybe some of you might not know what MOC is, and so I think our time is running out here. But so maintenance of certification part 4. So providers, pediatricians or family practice providers are required to earn 50 points of MOC part 4 within 5 years. So every 5 years they have to renew their cycle. And if Dr. Goodman-Lucy is on, I'm sure she can probably talk better about it than I, but so we are offering MOC for some of the QI projects we're doing. And as Heidi mentioned, like the asthma project, yes, there is a fee attached to it, but for the upcoming LEGO Prescription for Play project, if we get the funding from the LEGO Foundation, they actually will absorb the MOC part 4 fees, and providers can get them for free.
And also, just so you know, the American Board of Pediatrics, they came out, they said that they can bank their MOC now. So they can, if they do their MOC, they can actually, before they could never bank it. If they needed that, they had to do a project that year. Now they're allowing these providers to bank their MOC credits. So this is one is like, oh my gosh, I'm going to get it done and I'm going to bank it for next year. So I have some time. So that's been great too.
And yeah, I'm guessing that some of the folks on the meeting may not be familiar with the maintenance of credit, that is something that is oftentimes needed by the providers and the clinic, but it's just not something they hear about on a day-to-day basis. It's not in their purview, but MOC, it might be important if you want to throw out that acronym.
And also our QI projects also satisfy the PCMH component of clinics. So if a clinic like Southwest Children's, who's done work with us almost every year, our QI projects do suffice that I think one of the requirements, right, Gabby, for PCMH is QI, and our QI program does that.
Excellent. Okay, well, I don't want to move on if anybody else has a question for Gabby and Heidi. And feel free to pop it in the chat too, if that's easier. But, all right, great. Well, I'm going to share my screen again. I actually was able to take a look at the results that we've had so far on that survey we sent out, and I thought that it might be interesting to you guys. So let me pull those up. This is only 21 responses so far, and I'll just point out that it only took well, less than a minute and a half to complete. So if you see this email come across your inbox again, please feel free to do the survey if you haven't already, but really interesting. So does your employer require you to hold a license? We actually saw more than half of our respondents say yes. If yes, what is your license? I won't click on that, but it looks like we're seeing more nursing licenses. We'll double check that to make sure I'm right. Do you need continuing education credits to maintain your license? Again, almost half said yes. And then, oh, okay, I skipped over this before. Actually, for our CME. Okay, great. And then we have other, so I'll look at those other responses too. Very interesting, very interesting. Pharmacology was one, very interesting. Okay. Would having continuing education credits through UCCCN provide value? Overwhelmingly, yes. Would having professional development credits? Now, we're using that term a little bit more loosely, but this would be something that would show your employer that you're growing professionally by attending these things. And again, overwhelmingly, yes. And then this is also really interesting, a different topic, but the idea of maybe using a private Facebook group to be able to connect with each other. And we definitely see that the majority of responses are either very likely or somewhat likely. So that's really interesting. Now we'll want more data to come in, but just to give you a taste of what we're seeing so far, really interesting. So seems like maybe I've got some work to do. All right, and let's go back to our slides. And then this is very much what we've been talking about with connecting to each other in between these meetings. We have this listserv. It's a big, long email. Oops, I didn't mean to do that. Email address, but it's one that goes out to everybody who's on our list. You can grab that and send to it. There's no restriction for you being able to email to that. If you receive something from that email list, you can respond to it. Same. If you're uncomfortable going ahead and just sending something straight out to it, you send it to me and I send it for you. So no problem there. And we think this has just been a very valuable thing for our folks when there is something, that's very time sensitive, like this young man who needs to get to Orem. It's been a tremendous thing that we can use to ask for help. And that's what this group is all about. So fantastic. Our next meeting is October 19th, and it's all about transition. Now, the week prior to that is the annual summit around transition to adult healthcare that is headed up by Intermountain, but it's a statewide effort, and this will be the third or maybe even fourth year, and these just get better and better. And so we hope that you've received your save the date and invite to that, and we hope that you'll be able to attend that, but we'll also be doing a summary of that as well. And transition is very much a focal project of ours right now. We're excited about that. So with that, I guess we'll let you go on with your day. And we appreciate everyone being here. It was a great presentation. Thanks so much to the UPIQ folks. And if you have any questions, feel free to get in touch with me and I'll try and address those, but we'll also grab all of this great information and put it in the summary of the meeting that we'll be sending out. Thanks, everyone. See ya.